Hi, I wanted to take just a few minutes and give you the details of this clinical trial, give you some perspective of what it's all about. And again, a clinical trial is really what the research is all about to get the success in the laboratories into the human clinical phase to do these experiments so that hopefully treatments can emerge for the general public. So I found out about this clinical trial at Massachusetts Eye and Ear Infirmary, Harvard Medical Center, in May of 2015 through a press release from the foundation, and never really had any desire or intent to get involved with it. But as time evolved, I talked to the doctor, found out that I might meet the objective criteria, and that is that my vision was poor enough to be considered a candidate. So we went out to Boston in January of 2016, early to have some baseline testing. Probably in February, received a call from them saying that my tests did confirm that my vision is poor enough to meet their objective criteria to be involved in this trial. I did some soul searching, talked to some people, and finally decided that I would accept their invitation to participate in the trial. Really, the thing that put me over the edge is that I have been asking for support of the foundation to get to this point for many years now, and then when the opportunity presents itself to someone like me, I didn't really think it was right to just sit back and let somebody else do it. So I decided to accept their invitation. The testing that they did in January was only good for 90 days, so I was hoping that the trial would take place before April of 2016, and that did not happen. It got postponed to August 25th, believe it or not. And then in early August, and this is still in 2016, I got an email from them saying that they needed to postpone it again. They did not tell me the date when it would happen. So I was a little frustrated and disappointed, to put it mildly. And we still went out to Boston on August 25th, the original surgery date, to do some more testing. And at that time, they told me the surgery would take place on September 29th. So I went back to Boston for some baseline testing on September 27th, which was a Tuesday, I believe. And then the Thursday of that week, on September 29th, the surgery took place. And I was at the hospital at 6:30 in the morning. I was completely under the anesthesia, a general anesthetic, by 7:30 that morning. By 10 o'clock, I was waking up. By 3:30 in the afternoon, I was walking back to the hotel with a patch covering my right eye, the one that was treated. The surgical procedure involved injecting with literally a hypodermic needle underneath the retina about 500,000 partially developed stem cells. And the hope was that those stem cells would implant themselves in the retina, grow and mature into healthy photoreceptor cells, which are the rods and the cones in your retina, and then function as healthy cells and integrate themselves into the circuitry of the eye to restore some vision. The surgery went fine. There were no problems, no hiccups, no complications. Stayed in Boston for a while. So that surgery took place on Thursday. I went back for follow-up appointments on Friday, Saturday, Monday of the following week, Wednesday of that week, and then flew home Wednesday. I think that was October 5th. Went back to Boston for another appointment on October 11th. There was another appointment, I believe, on October 24th. Another appointment the Monday after Thanksgiving on November 28th. There was one on January 9th. And just got back from Boston for the 6-month follow-up, which took place on March 27th. The whole process, I'll be followed for a year. So I go back at the end of June for the 9-month follow-up, at the end of September for the 1-year follow-up. I think the trial will even now be considered a success because the whole purpose was to determine safety of the procedure, the surgical process, and there was no infection, there was no immune reaction, there was no problem that happened, and if it hasn't happened by now, it's extremely unlikely that it will happen. So in that sense, they're very happy, the clinical trial team, for what has happened. The other purpose of the trial was to determine the proper dosage of the stem cells. I received 500,000. The first 3 people in the trial received 250,000. 3 in my group received the 500, and then the last 3 are to receive, or have received, I'm not sure if they're done yet, 1 million of the stem cells. And then they will move into phase 2 of this trial to determine which of those dosages makes the most sense based on what they've learned. And they're very tight-lipped, as you might imagine, for confidentiality reasons as to what has happened with the other participants. But my gut feeling is that all of the 9 have received their injections, and the doctor did say that they're probably going to move forward with people that have better vision than me, which suggests to me that there might not have been any improvement in vision in any of the 9 people, but that's speculation on my part. For me, there has been no improvement in the vision. That was, like I said, that was not the goal of this study. It was kind of a behind-the-scenes hope. There's still time, they say, for that to happen, but I have pretty much gotten to the point where I've accepted that it's not going to happen. The important thing, though, is that they've learned an incredible amount from this trial. I know that it's going to make a difference, and even if this is not the treatment that evolves from this study, or treatment evolves from this study, I know it's going to help in future studies. Maybe a little bit about the cost, the way that was handled. Everything was paid for by the British company Renuron that sponsored this trial. I've been keeping track of it, and it's about $20,000 that they have invested in me just in travel and hotel. I have no idea what the hospital and the surgeons and all that costs. They don't share that with me. And the way it works is that I have to advance all the money, and then they reimburse me. And got a little bit nervous early on because they were not reimbursing me, and I had several $1,000s of my own money invested in this. But then they finally did, and to date they have reimbursed me for everything that I've spent. So that part of it has worked well. So I just wanted to give you that little bit of insight and behind the scenes. I've spent about 30 days total, I think, in Boston with the 8 separate visits. Love the city. It's really a great place to go. I've gotten familiar with it, and just want to thank you for taking the time to listen to this and the support that you've given to the foundation to help make something like this possible. Thank you very much.